America's choice in home care.
Hello. Welcome, everyone. My name is Mary Ellen Wilson with Visiting Angels of Gaithersburg, Silver Spring, Edgewater, and Washington, D.C. And we are super excited to bring to you our bi-weekly coffee chat. So today we have a brand new topic for us that I'm very excited about. But before we get started, just a little bit of housekeeping. Number one, we are live streaming on Facebook. Hello, Facebook friends. So if you do have a question out there in Facebook world, go ahead and put it in the comments section because we will be doing Q&A at the end of our little chat today. For those of you who are attending on Zoom, terrific. All you have to do is go ahead and put your questions either in the Q&A box or right on the chat screen. So we make it very easy for you. All righty, and just as an introduction, as I said, my name is Mary Ellen Wilson. I'm the Business Development Manager at Visiting Angels. I mentioned already we have offices in Gaithersburg, Silver Spring, Washington, D.C., and Edgewater, Maryland. So we service the entire surrounding area. And we bring home care to you and your loved ones. Today, we are going to be chatting with Sean Curry. He is with the Prevention of Blindness Society of Metropolitan, Washington. And this is a really neat this is a really neat topic this morning because we're going to be talking about low vision and aging eyes. And does aging necessarily mean your eyes are going to weaken? And are there steps that we can take? So Sean's going to explain all of this to us. So I am going to read a short bio so that you all feel like you know Sean as a friend. So Sean is the Senior Programs Manager at the Prevention of Blindness Society of Metropolitan, Washington, D.C. He leads the low vision programs, including the Low Vision Learning Center and Low Vision Resource and Support Group Network, as well as applies his public health background to collaborate with other organizational programs. Prior to joining POB, that's a mouthful. I think I'd rather say Prevention of Blindness. Sean completed his Master's of Public Health at the George Washington University. During this time, Sean was a scientist at a pharmaceutical testing laboratory and completed an internship at a county-level health department. He also holds a bachelor's degree in biology and health science. Sean has a passion for public health promotion, research, and direct community involvement. And as part of the Prevention of Blindness, Sean has provided multiple presentations about low vision and resources available to the community. Welcome, Sean.
Hey, thank you for having me. And
absolutely.
And thank you everyone for joining today.
Well, we are thrilled, Sean, and I guess we should start off by asking you, what is the prevention of blindness? I think that some of us need to have a little bit of a background here.
Absolutely, yeah. So the Prevention of Blindness Society of Metropolitan Washington, and we go by POB for short, was founded in 1936, and we're dedicated to the improvement and preservation of sight and quality of life by providing services and education, and by championing healthy vision and innovation to everyone in our area. We're the largest local nonprofit dedicated to vision health, and we impact nearly 13,000 community members in the DC metropolitan region annually. And our service area includes a lot of the areas that Visiting Angels does in the area. So it includes DC proper, Montgomery County, Maryland, Prince George's County, Maryland, and Northern Virginia, which is Alexandria, Arlington County, and Fairfax County. So we've had many different sight-saving programs, and these include children's vision screenings, a mobile pediatric eyeglasses clinic that visits low-income schools and provides comprehensive eye care services to students in need, and eyeglasses for the needy clinic that provides prescription eyeglasses to those in need at a significantly reduced cost compared to what they might be paying, out of pocket, especially if you either are not insured or your insurance isn't going to be covering eyeglasses anymore. We have an adult vision and glaucoma screening program. And this screening program provides, they go to health fairs, places of business, places of worship, and other common meeting locations to provide that service to the community. We have eye health education events with eye doctors and other specialists that discuss various eye health topics from, children's eyes to cataracts to legal blindness. And finally, we have low vision programs. And I'm going to be discussing a lot about the low vision programs today. And I really want to help raise awareness about what we provide. And almost all of them are free to the public. So all of these programs that we provide receive guidance from a medical committee, which includes more than a dozen medical doctors and other healthcare professionals. So we really value that the service we're providing has scientific backgrounds and evidence-based programming.
That sounds very interesting. So, wow, I didn't realize the Prevention of Blindness has so many different arms and into serving so many different types of people, from young children all the way on up. So thank you for that. I'm excited to talk about low vision. I always had 20/20 vision, and as I've aged, I am now wearing glasses. So is this just a normal part of aging that we all are going to have to go through?
So, that's called there's a lot of different aging eye conditions and diseases. Mm-hmm. And I'm going to start by saying I really highly recommend that anyone that may have an eye condition or you want to learn more about them to visit the American Academy of Ophthalmology or the National Eye Institute websites. They have a wealth of information and they help explain a lot of different eye conditions or eye diseases. And they do it at a level that most people will be able to understand and really appreciate what's going on with their eyes. And of course, if you have further questions or you think you might have any of those, you should definitely go visit your eye doctor and talk to them about your unique diagnosis. So, yeah, and the aging eye, it's important to know that losing your sight and becoming blind is not a normal part of the aging process. Now, needing eyeglasses over time or reading glasses, even things like cataract surgery, are not very rare and they're very treatable. Needing glasses over time is called presbyopia more often than not. And that occurs in nearly everyone as we age. And this is when you might notice things that up close may become difficult to see. So you may see, you're holding a book and it used to be like this and now it's arm's length away. So you're really having issues with that. And, reading glasses or prescription eyewear and even things like LASIK surgery can correct that. Another relatively common eye condition is dry eye. And those with dry eye, often what's happening is you're not producing enough of the proper type of tears. So you might be experiencing itchy or scratchy eyes or eyes that are watering nonstop as well. So it's producing a lot of water, but it's not the right kind of tears. Luckily, dry eye can be correctable with some over-the-counter medications and over-the-counter treatments. And also there is surgery available in more extreme cases. So those are pretty common eye conditions that you may see. Now, those eye diseases that are not common, but they do occur and they're associated with aging. And these are not considered part of the normal aging process. And they can cause permanent vision loss or even legal blindness. And these include age-related macular degeneration, glaucoma, and diabetic retinopathy. And all of these need to be treated and diagnosed as early as possible to prevent any permanent vision loss you may have from these eye diseases. And the best way, and often the only way to catch a lot of these eye diseases early to prevent or slow permanent vision loss and maintain your best sight is through regular, comprehensive, dilated eye exams. So that's the exam where they put the drops in your eyes and you might feel like your eyes are a little blurry and your pupils become huge. And they do that so that way the eye doctor can look in the back of your eye where a lot of these aging eye diseases will present themselves. And also these exams can catch diseases that aren't just in your eye. So potentially find other health problems just by looking in the back of your eye. Remember, an ophthalmologist is a medical doctor. So that means they've gone through med school exactly like the doctor you'll see at your office for your checkups. But they're specializing now in the eye. So they can really treat not just the eye, but also look at the entire person when they are looking at your eyes.
Right, right. So as part of your comprehensive health maintenance, yearly maintenance, an eye doctor exam should be on that list. So
especially if you're over the age of 50, you should be every year. Or if you're over the age of 50, or more often. If your doctor says go more often, go more often.
So now tell me about low vision. Give us a definition. What is low vision?
Yeah, so I mentioned all these eye diseases and conditions, but yeah, what is low vision? So low vision is vision loss that cannot be corrected by medical or surgical treatments, or even through conventional eyewear, so your prescription eyeglasses or contact lenses. And low vision can make completing everyday activities, such as reading or driving, very difficult and could eventually threaten your independence. Again, low vision is not a normal process in aging, and you can experience low vision via central or side or peripheral vision loss. You may also experience poor contrast sensitivity. So that's a really long term to say when you're looking at blue and black colors, you may not be able to tell the difference. Or another example is newsprint. That's a really, really common one that I hear from clients is that I can't read the newspaper anymore. Well, the newspaper is black ink on gray background, and often it's also very small print. So having poor contrast sensitivity will definitely be seen there. And then another way that you might experience low vision is with depth perception problems, such as going down the stairs. And of course, that's a fall risk, especially for older adults.
Definitely. Definitely. So is low vision more prevalent in older adults rather than young adults or children? Is it associated with aging, I guess, is a better question.
Yeah, so not everyone with low vision is older. However, it is more common as we age. And that's because these aging eye diseases occur again more often as we get older.
Right, right. Do we know what causes low vision?
So low vision is often caused by one of these aging eye diseases that I previously mentioned. It can also be through a congenital problem. So the most common congenital eye disease is retinitis pigmentosa, or RP. There's another one called Stargardt's disease. And those all can lead to low vision. Even having cataracts that are untreated can be low vision. And cataracts, it's the leading cause of blindness in the world and in the developing world. But now we have surgeries available for that, and it's one of the safest surgeries out there. So you don't see permanent blindness or low vision as often in persons with cataracts now because it's really easily treatable.
Interesting. All right. So what do we do if we have low vision, if we are experiencing low vision, as you say?
Yeah, so POB has a lot of different low vision programs. And I'm going to mention them in a minute, but first I'm just going to highlight. Often you're going to be with your eye doctor and they're going to want to, they want to help treat the disease. And it might get to the point where, there's not much more other than treating the eye disease and preventing more vision loss from occurring. You might get some back in certain conditions, but really at that point then you get referred to someone who is a low vision specialist. And these are either optometrists or ophthalmologists, and they have gone through not just their degree, but then they've gone through a specialty program about low vision and how to treat it. And that's called low vision rehabilitation. So low vision rehabilitation is, again, for the patients who are referred, and you get an exam there, and the exam involves developing a personalized rehabilitation plan for your individual goals. So not everyone has the same goals. A 30-year-old may want to still work. They may want to still, I want to go run a marathon, or I want to go anything like that, versus an 85-year-old individual who, I just want to go to the store and be able to run my errands and do my laundry. So it's really important to discuss with them, and you're going to work one-on-one with them to discuss what your goals are. And then you're also going to then evaluate the function of your vision. And that's what it's really focusing on, is how is your vision functioning with your everyday life. And what's going to go along with that as well in an exam is evaluations, counseling. You're going to learn about different coping strategies and learning about and practicing various visual aids. In addition, in rehabilitation, you may need further referrals that a specialist can provide. So these could be things such as to your jurisdiction's Rehabilitation or Disability Services Office. In Maryland, it's called DOORS, so it's Department of Rehabilitative Services, and they have an older blind and visually impaired department, and some other ones as well. Or you might even be referred to various different services like a Talking Books program or Metro Access, or even the POB Low Vision Learning Center, who can help you navigate all of these resources and services. And again, I want to stress the focus of rehabilitation is to maintain or regain your independence and quality of life. Doctors are going to stress the compensatory and adaptive strategies to perform these activities. So this might mean, different ways to be viewing different adaptations you can make, whether it be, inverting colors on a background, using a magnifier, different types of lighting, which is huge, or even learning with different senses. So instead of using your eyes, maybe you're using your ears now, or you're using your sense of touch. And it's really important to know that even if you have low vision, we hear that a lot of people, they want that magic pair of glasses that's going to restore their 20/20 sight. Unfortunately, that's not around. If there was, these low vision specialists wouldn't be in business. Have to just give you those pair of glasses and then send you on your way.
Yeah.
There are many different ways to optimize whatever sight you have left and learn different compensatory strategies as well.
So that's very interesting. So there is no cure. You can't regain your vision, but there are strategies, adaptive compensatory strategies, as you mentioned, that will help you navigate through your day.
Correct, yeah. And they will go over that with you. And then they may also refer you to an orientation and mobility specialist or an occupational therapist who specializes in low vision. And those are other professionals that have specialized training in their craft, and they can be really, really helpful depending on your level of sight, what your goals are, and how they can be of service to you, and they can work with you one-on-one.
Okay. Do we know what causes it, by the way? Is there any other, I guess it's a symptom of other eye diseases?
So low vision, it's when you have vision loss that can't be corrected, and it's caused by these different aging eye diseases.
Okay.
It can also be from something like a trauma to the eye. So, if a lot of this kind of started back in World War II is when legal blindness was determined, and that all had to do with a lot of veterans coming home, and they had all kinds of eye problems, and some of that was due to trauma to the eye.
Gotcha.
More often than not, it is different. The aging eye diseases like macular degeneration, glaucoma, and diabetic retinopathy.
Okay. All right. A question just came in since we're in this arena. Are eye diseases hereditary? I think this is a good place to ask that.
Some of them are. A lot of the aging eye diseases, family history is one of the higher risk factors. So, if your father had glaucoma and your mother had glaucoma, you're probably at an increased risk of having it. Do specific research on any sort of specific genes or how likely specifically it is. But they do say that it is more likely, if you have a family history of it, that you might get that. So if you do, again, just keep getting your eyes examined. And another thing that you can do is just follow a healthy diet and stay active and keep your eyes safe as well. So that'd be something like wear sunglasses when you're out. If you're going out and doing yard work or you're playing a sport, maybe wear protective eyewear, and just to prevent any trauma that comes to your eye as well.
Right, very good. Okay, so tell me about your low vision programs with the prevention of blindness.
All right, yeah, I'm very happy to. And I'm going to preface this with all of these programs I'm about to say are free, and they're welcome to anyone in the community that we serve. So the first program we have is our POB Low Vision Learning Center. The Learning Center is a great way to learn what all is available. The goal of the center is to provide the resource and service navigation that can save you hours of work. So many people who are new to vision loss, they're unaware of all this. Often they might be a little bit more seasoned in age and might be scared as well. It's a huge, huge coping ordeal when you're losing your sight. Studies have shown that lost vision has the same or close to the same emotional impact as losing a loved one. It's a very, very traumatic experience often at first, and it takes a while to get over or get through, excuse me. So there are hundreds of resources, devices, and aids available, as I said, and navigating can be difficult and also can be expensive. A lot of these different aids and devices that are available, they're not covered by most insurances. And there's also some that can be hundreds or even thousands of dollars. And there's also things that maybe that's there, but you may benefit from something that's $10. So our goal is to make sure you're spending as little amount of time as you need to. And also, we don't want you to have to spend a lot of money because they can add up, and we want you to enjoy your life. So our center aims to prevent this pain and help you find what you need as soon as possible. And at the center, we have 2 staff members who are visually impaired themselves. So they are not just experts by learning on the job, but also through living it. And they can provide one-on-one appointments in person. Currently, that is not available due to the COVID-19 pandemic. However, our resource and information hotline, which is still running and is one of our great services, is still available. And it's a great opportunity for individuals to call and ask any sort of questions they may have, from, let's say you need help reading the newspaper, to, I want to drive again, or I want to get around town, or even I need help finding groceries or getting to my medical appointment. They can help you out with finding that resource that's available for that. The center also can help provide these referrals to the different resources and services, and also provide technology, aid, and devices practice. So at our physical center, we have dozens of magnifiers, different other aids, CCTVs, non-visual aids, and it's a chance if you wanted to go in and practice with them, or let's say that your low vision specialist is going to give you, going to prescribe you a magnifier, and he's not quite sure, do you need a 2x or a 3x here for what specific task you're trying to do? It's 50-50. Well, maybe you come and visit and you try the 2x and the 3x with the task you want to do. And then you just report back to the specialist and they can help, and then they'll know. Mm-hmm. And our hotline remains active. And the phone number for that is 301-951-4444. And we're active Monday through Friday from 11 a.m. to 5 p.m. If you call outside those hours, you just leave a message and the specialist will be able to get back to you. So again, this service is free. The next program that we have is our...
Just need 1 second, Sean. I just wanted to let everyone know I am putting that number in the chat box. And Sean, I just want to make sure, 301-951-4444.
Yes, ma'am. Yes. And I'm happy to share that with you, Mary Ellen, at the end of this as well.
Great. Okay.
All right. So the next program we have is our Low Vision Resource and Support Group Network. So this network includes 12 area resource and support groups, and we also can help you provide speakers or topics to other groups upon request. And we actually helped out about 15 other groups last year as well. Just provide them with a speaker or a different topic, or we came and talked about POB. Mm-hmm. So these meetings focus on both informational and social support through peer learning and occasional guest speakers on various low vision related topics. Last year, we had more than 1,000 attendees at POB leg groups, and these groups meet regularly, either monthly or quarterly. And we discuss a different low vision topic, from a helpful resource to the latest research in things like macular degeneration or glaucoma. In addition, as part of this network, we have a monthly large print and online newsletter. It's called Your Eyes Today. This free newsletter includes low vision related topics, educational pieces, and also provides listings of all the upcoming group meetings and events we are having. In the newsletter, there's also a blog now called The Low Vision Perspective. And this blog is written by 2 individuals with vision impairments. And they write about daily living strategies or living with low vision, and also useful technology hacks for those with vision loss. And again, you can sign up for this newsletter, ask about the group meetings, and learn about anything else we're doing in the community, or if you have any suggestions you would like to see in the community, by calling our hotline, the 301-951-4444 number. Or again, you can email us at communications@youreyes.org. And again, I'll provide that to you all, to Mary Ellen at the end.
Terrific. So I am very confident that very soon, in the not too distant future, we will be able to meet in person again. So tell us, so tell us where your center is located.
Yes, our center is located in Bethesda. However, you can always call wherever you are. Mm-hmm. And it is located in downtown Bethesda on 4948 St. Elmo Avenue. And again, Bethesda, Maryland, zip code is 20814. Our headquarters, in our headquarters location, and at the headquarters we have a low vision rehabilitation office there, and you can also always contact us there. It is 415 2nd Street Northeast, Suite 200, and that's in Washington, D.C.
Terrific. All right. So we are running just about at our time. So tell me, what else did you want to share today?
Yeah, so I'm really happy to announce that POB has a couple new initiatives we've been doing, and this was all as a pivot from COVID-19. So, when COVID hit, we realized, we have to shut down because we're very, very focused on being out in the community and providing services. And unfortunately, when COVID hit, we had to stop doing that. So we decided to focus on some other virtual events that we can do. And the first thing we did was our low vision town hall. So this town hall was created in March, and it's led by myself and a low vision specialist, Dr. Suleiman Alibi. And this town hall provides various different resource and information sharing. We have guest speakers and very related topics. So initially, we were talking all about, where can we get, this was for our low vision individuals. Okay, where can we get groceries at? Some people may not be aware, but a lot of individuals with vision impairments or low vision beforehand, they were getting their groceries delivered to them. Either be that through a local grocery delivery service or a village person, as someone from one of the villages. And unfortunately, when COVID hit, everyone else decided to do that. And, people were issues in getting the groceries. Yeah. So, we're discussing things like that. And then it's kind of morphed now to where we're talking about more specific low vision related topics. We've had a low vision occupational therapist on, a social worker who works with individuals with low vision on. Our most recent town hall was about accessible voting with low vision, which we really were happy to have the different jurisdictions on to discuss, what's all available to those with low vision and how the heck can I vote if I can't go in or if I'm having vision issues.
So how the heck can they vote?
Yeah, so the great
do
thing.
tell.
Yeah, go ahead.
No, I was saying, so do tell. Don't keep it a secret.
And, this will be all on our website here in the next couple weeks. But in the state of Maryland, everyone is being mailed, and you should have already been mailed if you're in Maryland, an application to sign up for voting by mail. And you just have to fill that out. And if you fill it out and complete it, you'll be then delivered a mail-in ballot to be able to vote by mail. And there's a bunch of different drop boxes around. If you don't trust USPS, we've heard all in the news about all these worries about that. So if you're worried about that, you can use the drop boxes or just USPS again. The biggest recommendation that we received was if you're going to vote by mail, please do it as early as you can. And then you don't have to worry about any sort of late voting happening. And it'll also help them come election day to be able to handle all of the incoming votes. You can also vote early. I don't have dates in front of me, but I believe Maryland starts on October 26th to November 2nd, so it's the week before Election Day. And when you vote early, you go to one of the early voting centers, and you can vote in person that way. In addition, there's accessible voting. If you're voting in person, all of the different accessible voting options are available, whether that be through audio, through large print. Sip and puff is another way that some individuals might be doing it. So yeah, there's a bunch of different ways to vote. And yeah, the only recommendation I have is to please go out and vote when you can. Yeah. And it's, yeah.
Okay, so that's
I have a recommendation on that, but you just vote.
I know we can't go any further than that, Sean.
Yeah, exactly. I'm not going to.
Stop there, please. So yeah, the point is to just vote. But I find it interesting. I forgot that at most locations, and I think it's mandated at it's all locations, right? Have some type of adaptive service there for.
Yeah.
Yeah. So. Okay.
And if you run into any sort of voting issues, we're going to post on our website, youreyes.org, the different phone numbers you can call. So if you have any accessibility issues or if you had questions beforehand, give that number a call and just voice your concerns and see what they have to say.
Great.
They're really going to want to help. The Montgomery County, we had a person on from Montgomery County, and they were very, very well spoken. They knew what they were talking about, and I think that they would be a very useful resource to you if you have any comments or concerns.
Terrific. Okay, let's wrap it up with last comments from you, Sean, and then we'll open it up for questions.
All right, so I just have one more initiative that we just launched last week, and something that I think would be really useful to the community, and that's our low vision mask project. So when COVID hit, we realized, individuals with low vision, they might be having issues when they're going to the grocery store or going to places of business because all of the different recommendations or any of the guidelines or even like we see the arrows on the floor telling you which way to go. Those all rely on visual cues. So I see that's an issue.
Yeah.
So our solution to that was we created a face mask since everyone's already wearing face masks, and we partnered with the Checkered Eye Project to create these masks that have the low vision insignia on it, or the checkered eye insignia on it, for you to wear out in the community. This mask you can get for free, and again, you'll call our hotline if you want it. It's free to individuals in Montgomery, Prince George's County, DC, and Alexandria, Arlington, and Fairfax. And another goal of that was to raise awareness in the community about low vision. And we're going to be working with chambers of commerce to spread this information and provide some, frequently asked questions about like, how can I make my business more accessible or more comfortable for someone who may have a vision impairment? And we're sending that out to everyone in the community. Again, if anyone on this call has any questions or would like to sign up for a mask, we ask that you only should wear the mask if you have low vision yourself. So want to wear it if you're just kind of supporting the cause. I really appreciate that, but it is to help designate and raise awareness about like, hey, I have low vision. So if I don't see you 6 feet away, that might be why.
Right.
But you can contact our hotline, or you can even call our headquarters or email us, and we're happy to help you sign up. Or if you want information about if you want to help spread information, we can help out with that as well.
Sounds terrific. I love that. All right, let's see if we have any questions. We did ask this one already. And let's see here. Let me look at my chat screen. Wow, we have a quiet group today. I don't see any additional questions. Tiffany, did any questions come in via Facebook?
No, no questions via Facebook.
Okay, terrific. So I'll give it another second for anyone, because I know last time we were finished and then a question came in. So I will give it a couple of seconds while I thank you, Sean. I think that the work that you're doing is really just tremendous. I had no idea that the Prevention of Blindness had so many different programs, and what a valuable resource to our community you all are. So that is terrific. And I will also share that if you or a loved one are experiencing low vision and you would like companionship, that is up our alley at Visiting Angels. We do provide home care support, companionship, and personal care should you need that. And of course, you can always reach out to us at 301-355-6578. And I'll let Tiffany put that in, 301-355-6578. All right, one more check of the questions. I don't see any. We have 2 minutes left, Sean. I'm going to let you take us out. Anything else you wanted to add or share?
No, not at this time. Well, one thing, so those if you're near Kensington or if you're near Alexandria, we have resale shops. So those are like thrift stores. So if you're into thrifting, or if you're into buying antiques or knickknacks or furniture even, and we also have clothing, our resale shops are there. There's one in Kensington and there's one in Alexandria.
Wow.
And, yeah, and all of the money that's made through that goes directly back into the programs that we provide. And like you said, we do have quite a few, and it does require some money to keep us up and running. And we appreciate any donations that anyone would be worthwhile. And there's some
can we donate our
yes. Yeah, you can donate things there too.
Great. Household items, jewelry, that kind of thing? Okay, terrific.
Yeah.
That's always a great resource. And what is the name of your shops?
It is called the Look Again Resale Shop. And I don't have the addresses. It's on our website on urs.org.
Okay, that's a great name for a consignment store too. All right, folks, that is it for today. I wanted to let you know later today we will be announcing that we are hosting a virtual memory screening, and there will be information going out to you all later on today. So we will be doing that with Kensington Park Senior Living. And it is literally a Zoom call, very confidential, free of course, where you will do a little memory screening and by a registered nurse, and then she will direct you as to whether or not you need additional screening or testing. So that is going to be on the 16th, and then next week, 2 weeks from now, so that would be, I believe, the 23rd, we will be talking to Sheila Griffith of the Alzheimer's Association, and we will be talking about different dementia-related behaviors and what you can do. All right, Sean, thank you, thank you, thank you. Thank you, everyone that tuned in. Have a great day, and we will see you again soon. Bye-bye now.
Thank you, everyone.